Welcome to this video on the 2025 UK Medical Eligibility Criteria for Contraceptive Use provided by the College of Sexual and Reproductive Healthcare. This video covers the core principles and categories that form the foundation of UKMEC guidance. The UKMEC prioritizes safety, emphasizing clinical judgment, contraceptive-specific recommendations, and evidence-based practice, even for off-label use. Categories 1 and 2 define conditions where there is no restriction on use, or where the advantages generally outweigh the risks. Categories 3 and 4 represent more serious cases, where risks usually outweigh advantages, or where the health risk is considered unacceptable. When managing multiple risks or potential drug interactions, clinicians must carefully weigh the total risk and consult appropriate resources. To effectively use the summary tables, it is important to understand the standard abbreviations for contraceptive methods. This table provides an overview of common methods, including their full names and types, while noting that I stands for initiation and C for continuation. We will now examine personal characteristics and reproductive history, which are key factors in determining contraceptive eligibility. Here we see UKMEC guidance regarding pregnancy, age, and parity for various contraceptive options. This table highlights recommendations for the postpartum period during the first 6 weeks, specifically considering VTE risk factors. This section details specific guidance for postpartum IUD insertion and the impact of breastfeeding on method choice. When considering post-abortion scenarios or histories of ectopic pregnancy and pelvic surgery, the UKMEC provides clear safety categories. For smoking, eligibility varies significantly by age and intensity of use, with higher risks associated with combined hormonal contraceptives. Finally, this table outlines UKMEC recommendations for patients with obesity or a history of bariatric surgery. This slide outlines the UKMEC recommendations for patients with a history of organ transplantation, categorizing risk for various contraceptive methods. We now transition to cardiovascular disease, covering hypertension, ischemic heart disease, and venous thromboembolism. This table details eligibility for patients with multiple cardiovascular risk factors or controlled hypertension. For patients with consistently elevated blood pressure, specific risk categories apply, ranging from stage 1 hypertension to established vascular disease. The UKMEC provides distinct guidance for patients with a history of ischemic heart disease or stroke, including transient ischemic attacks. When assessing patients for venous thromboembolism, these tables help determine the safety profile for different contraceptive options. This slide summarizes key risk factors associated with venous thromboembolism to guide safe clinical decision-making. Recommendations for patients with inherited thrombogenic mutations or valvular heart disease are outlined in this section of the guidance. This table addresses eligibility for individuals with cardiomyopathy or cardiac arrhythmias. Moving to neurological and mental health, this section covers migraines, multiple sclerosis, and mood disorders. Guidance on headaches and migraines is presented here, distinguishing between different clinical scenarios. This slide details eligibility for various neurological conditions, noting that certain drug interactions may affect contraceptive bioavailability. Regarding anxiety and mood disorders, the UKMEC emphasizes individualized counseling and monitoring for patients starting hormonal contraception. The final section covers reproductive health concerns, including gynecological issues and breast health. Finally, this table provides clarity on eligibility for patients presenting with specific bleeding patterns or endometriosis. We now move to gynecological conditions, beginning with recommendations for ovarian tumors and the management of dysmenorrhea. This table outlines the UKMEC safety categories for various cervical conditions to ensure appropriate contraceptive choices. The guidance for breast conditions is detailed here, distinguishing between benign disease and a history of breast cancer. This section summarizes the criteria for both breast and various reproductive cancers, providing essential safety data for clinical practice. The UKMEC also provides evidence-based recommendations for managing fibroids and anatomical abnormalities of the uterus. When addressing pelvic inflammatory disease, the guidance clearly distinguishes between active infection and a history of the condition. We now address systemic infections and endocrine conditions, which can influence contraceptive safety and efficacy. This table covers eligibility criteria for sexually transmitted infections, a crucial area for contraceptive counseling. Specific considerations for patients living with HIV or undergoing treatment for tuberculosis are presented in this section. The UKMEC provides comprehensive guidance for managing contraception in patients diagnosed with diabetes. This slide outlines recommendations for thyroid disorders and chronic kidney disease, highlighting contraindications for certain methods. Guidance is also provided for gastrointestinal issues, specifically focusing on gallbladder disease and its interaction with hormonal methods. This section details the safety categories for patients with viral hepatitis or established cirrhosis. Lastly, we review eligibility for liver tumors, inflammatory bowel disease, and various anemias in the context of contraceptive use. Thank you for watching this summary of the 2025 UKMEC. Please consult the official FSRH guidelines for full clinical details.